The House of Representatives say the need to reposition the healthcare sector to meet numerous emerging challenges is crucial to its improvement. Speaker of the House of Representatives Honorable Tajuddin Abbas, speaking at a public hearing on 16 bills aimed at establishing one health institution or the other, say the structural quality of a health system is heavily influenced by its healthcare infrastructure. Hence, the need for oversight functions to healthcare institutions across the country to look into the undeniably evidence of infrastructural deficiencies of health services, lack of equipment which results largely from inadequate funding of health institutions by the government, and a total lack of maintenance culture for equipment provided. The speaker, who was ably represented by Honorable Martin Oke, believes to succeed in this era, a system that is well invested on human resources and medical intelligence serve as the backbone of the health sector.
Today's hearing, no doubt, is in line with the agenda, and so also I expect the outcome. Distinguished stakeholders, I wish to urge you to freely express their views, so opinions, either for or against the subjects of this hearing, in a manner that will bring about the sustenance of our collective will to be together as a nation.
Chairman of the House of Representatives Committee on Health Institutions, Honorable Amos Magaji, says the disheartening migration of health workers from Nigeria to other countries in search for greener pastures poses significant challenge to the nation's healthcare system. Magaji said the evidence of the hearing is to provide guidance on the actualization of the federal government's commitment to improve the healthcare sector through the wide distribution of healthcare institutions in Nigeria. He said that as a result of the growing population, there is need for reference hospitals closer to the people, particularly in rural and suburban areas.
More recently, there has been an enormous migration of doctors, nurses, and other health workers in search of greener pasture in other countries, leaving Nigeria health sector severely understaffed. The need to reposition the healthcare sector to meet numerous emerging challenges is critical to its improvement. To succeed in this era, a system that is well invested on human resource and medical intelligence as the bedrock of the healthcare sector is required.
In his remarks, the Minister of Health and Social Welfare said the health sector research, including that of cardiology, is already taking place in many fronts in Nigeria, while establishing the institute will be an additional financial burden on governments, adding that government is cutting down on the cost of governance by pruning down agencies of government. Represented by a director in the ministry, Dr. Jimo Salawuddin, the minister said the ministry remains enthusiastic and supportive of every effort geared towards ensuring growth and progress in the health sector.
Establishment of the college will further boost economic activities of the area where it is sited. The migration of health workers and the epidemics and their emerging trend underscore the need for Nigeria to have enough and an efficient health workforce that will be readily available when there are any health emergencies. This is the observation of the ministry and our position. The Federal Ministry of Health has no objection to the establishment of the proposed federal tertiary health institutions. However, this should be based on merit.
The Nigerian Medical Association and other stakeholders at the forum who commended the lawmakers' efforts also gave advice on how to improve the healthcare system in Nigeria.
Government must pay serious attention to the concept of PPP in running public health service facilities as a way of improving funding and quality of care. Federal tertiary institutions shall be encouraged to, within the prescription of relevant extant law, operate PPP in provision of healthcare services and programs.
If you closely look at those admission requests, over 8,500, they have a JAM requirement at that time of 205 O-level credits. But we can take only 150. Where are we going to leave those young Nigerians that have JAM of 200 and O-level results of physics, chemistry, biology, English, maths? Are we throwing them on the streets?
The establishment of this medical center is long overdue in Jigawa State. With a population of over 5 million people, lack of federal medical center forcing residents to travel long distance for quality health, this amendment will address the healthcare disparities in the region.
It is hoped that the frequent migration of health workers can be managed if the proper infrastructure is in place. Anieti Patrick, Core TV News, Abuja.